Hi, my name is Stephanie.
Hi, I'm Michael.
Welcome. So you've been asked to go to the Cath Lab. In today's video, we will offer a brief introduction to the Cath Lab. Our discussion will include a few items: lead, where to get it, donning and doffing, and the thyroid cover. Where the Cath Labs are: Labs 10 and 13 and 14 and 15, donning and doffing, hair nets, beard covers, and face mask, where to stand and what not to touch. Here in the Echo Lab, by our break room, many of you have probably seen the lead rack. There are a few sizes and type options to choose from. You'll want to choose one that's comfortable. None of them are going to be perfect. There are 2 aprons and 3 two-pieces. We will put these on in just a minute. First, let's show how you find the Cath Lab.
This image is on the 6th floor at the end of the hallway in the North Pavilion. If you turn left, you'll end up in the TEE stretcher bay. And if you go right, you'll see a long hallway.
In this image, if you follow the hallway to its end and go left, you'll find Cath Lab 14 and 15 on the right after you make that turn. If you turn left, here, next hallway on the right is the entryway to Cath Labs 10 and 13. There are some slight differences between Cath Lab 14 and 15 and the rest of the labs. First, let's get our lead on. The 2-piece leads, the bottom is the long piece, and this is how you put it on and buckle the buckles. The vest goes on second, like this. And don't forget your thyroid cover, as well as placing your badge on the outside of the lead.
The apron goes on like this, and it doesn't have any buckles, so you'll want to make sure the Velcro fits snugly. In these 2 rooms, you'll find the bouffants, face masks, and beard covers here by the sink. If you have a beard, you'll want to make this beard cover the first thing you put on. Next is a surgical mask. You'll need to tie it so it stays on. Finally, the bouffant or scrub cap. Make sure all your hair is tucked neatly inside. The last thing you would want to be is the cause of someone getting an infection. Please remember, do not go inside the Cath Lab without covering your hair.
The first thing you should know once you are inside a Cath Lab is that there are a few important precautions. In some cases, the CV techs may have already opened and draped the sterile field. Let's be careful of what we touch. Anything that is blue is probably a sterile surface. Give yourself space to go around. If you need something moved, like the sterile instrument table, ask for help.
This image shows some examples of what you may see in the Cath Lab. And remember, if it is blue, you should avoid touching it.
After you have gotten to your spot here on the left side of the patient or at the head of the bed, it is time to get set up for your echo. In some situations, the C-arm or bed may need to be moved so that we can get more ergonomic or comfortable way of scanning. So please ask the CV tech to adjust the C-arm or slide the bed as needed. It is important to be mindful of the C-arm. It is the source of radiation while you are here in the Cath Lab. Unfortunately, we stand very close to it to scan. So please make sure you have your lead on correctly and your body positioned so that the lead can protect you. Once you are in place and the doctor has asked you to start scanning, there are tips you should know. 1. Place your hand underneath the drape. The top surface drape is sterile. 2, if something is about to fall from the drape, let it fall. It too is sterile. And number 3, listen. The most important thing to remember when in the cath lab is to always listen for the instructions. It is common for the procedure room to be very noisy and distracting.
When being called to the cath lab, there are some common procedures you will encounter. We will share with you a brief overview of each of those procedures, along with what images they are looking for. Right heart biopsy. This can help diagnose rejection in heart transplant patients. Through a sheath inserted into the right ventricle, 2 to 4 tissue samples are taken from the intraventricular septum, using a little metal tool called a biotome. Before the physician starts to take tissue samples, there needs to be a color Doppler baseline of TR. It is our responsibility to ensure that the catheter is pointed in the area of the intraventricular septum. Taking tissue samples from the free wall or apex risks pericardial effusion. We will look for effusions throughout the study. Before finishing up, take one final color Doppler of the tricuspid valve and intraventricular septum to rule out procedural VSD and check for pericardial effusion.
Alcohol septal ablation. Bring DEFINITY for this next exam. This is generally used to reduce the size of the sigmoid septum in patients with LVOT obstructions. The catheter is inserted deep within the intraventricular septum through the coronary arteries as close to the vessels that feed the sigmoid tissue as possible. No pre-images are generally required unless asked for. Before the physician starts the procedure, give the DEFINITY to the nurse and they will know what to do with it. It is our responsibility to image the septum as well as we can to show the team when DEFINITY is pushed without the contrast button on, just 2D, where they are getting the highest concentration of contrast. That location is where they are going to infarct the tissue in hopes of reducing the size of the sigmoid septum. We will look for effusions before leaving the procedure.
Balloon valvuloplasty, also known as BAV. By performing this procedure, the valve will be temporarily opened and symptoms of aortic stenosis will be reduced. We will need pre-procedure imaging for gradients and AI, no matter if either has been reported previously. The catheter is inserted through the aortic valve and a small balloon attached. As soon as the physician determines the balloon is in the correct place, they will inflate it to expand the valve. We will need to check AV gradients, assess major AI changes, and evaluate for pericardial effusion. In some cases, there may not be a significant change in gradients, and the doctor may decide to re-balloon the valve. If this occurs, we will re-image for the same changes as before.
Now that you are done with the procedure, clean the ultrasound machine. Make sure your images are being sent over. I generally send them a second time to be on the safe side. It is a long walk to the cath lab just to resend images. There are preliminary reporting examples for each procedure in the Share Drive and Google Sheets. We encourage that you use them for the most accurate preliminary reporting. Thank you for watching.
We hope you found this informative and helpful. Now let up and save a life.